Hi active Austinites, this is Dr. Mary Arnold again. Hope this video finds you well. I wanted to hop on and go a little bit more into our sciatic discussion that we kind of started. So the first video kind of talked about what it is, what it's not, what might be going on, what types of symptoms we might be feeling, and I wanted to come on here today and talk through a little bit about at a physical therapy evaluation, what types of things we might look for, as well as a quick and simple test that you can do at home to maybe determine if sciatic nerve irritation or sciatica is maybe a part of your pain problem. So we talked last time a little bit about needing to check all of the joints down the lower quarter in terms of range of motion, muscle strength, soft tissue irritation, and sensitivity, right? So that would definitely be included as a part of physical therapy evaluation to determine where exactly along this route things are getting a little bit hung up. One of the main tests that I like to do with my patients to really kind of see exactly what's going on, as well as it tells me a little bit about what areas the nerve might be a little bit stuck at, is doing a pretty simple test called a slump test. And what that test does is it puts the nerve on max tension. And we can see if by doing that, does that recreate some of the symptoms that we feel? And if that does recreate symptoms that we feel, there's usually a pretty good chance that the nerve is involved and a little irritated with whatever the whole problem is that we have going on. So let's talk through that slump test, and maybe you can do it at home and see if it is a part of your pain experience. So I'm gonna back up and make sure you guys can see me well. And so what I would do with my patients in a slump test is first have them sitting with their feet nice and planted on the floor. Then what I do is I'd say, go ahead and give me your best slump posture. Like your mother would just be so horrendously upset because she always told you to sit up nice and straight. And with this, we want to make sure that we let the head fall too, right? Because even though my sciatic nerve, like we found out last time, is only from, in my buttock area and works its way down, all of the nerves start at the spinal cord. And so max tension is going to be all the way up at my neck because that's where my spinal cord starts, right? And so when I get into this position, I would then tell my patient to go ahead and kick the leg that we have symptoms coming down. Try to kick that straight for me. And I would ask whenever we do that, what do we feel here? And they may or may not tell me that they have symptoms or that it connects with their pain experience, right? So first we check at the knee, right? Do we have anything here, yes or no? If the answer is yes, I stop and I don't need to go further. As well as we might just get down to this position. If the nerve is really irritated, we might just get to that slump position and my patient is saying, hey, that's coming down, that's connecting. So then we wouldn't need to go and do the knee, right? But let's say we did this position and we didn't have any issues. Okay, then we do the knee. Let's say this time we don't have any issues here. But what I would do now is I would ask them to pull their toe towards their shin and add that last bit of tension at that ankle, and then see, does that bring on or connect with any of their symptoms? And if it does, again, that rules in a part of that rules in that sciatic nerve being a little bit irritated, as well as not being able to tolerate tensions, right? And where each level at which I give tension to tells me a little bit about where that nerve might be irritated, as well as when I put tension, how far the symptoms go down, right? The leg. It'll tell me a little bit about that irritation. The other thing that we can do here in this position is I can ask them to move the ankle either in or out and see, because we know that that sciatic nerve branches off, right? Some of my patients say that the symptoms come down the side of their legs, or that they go into the top of their foot or the inside of their foot. And so getting that ankle to move in or out just kind of puts a little bit more information in my book about maybe what branches that come off of the sciatic nerve are irritated. And just like we can move the ankle in and out, I can also move the leg in and out too. And that will also tell me what other branches off of the sciatic nerve might be irritated and might be involved in this pain problem. So go ahead, try this test at home. Leave in the comments if things were positive and maybe you found some symptoms, as well as if everything looked good with your sciatic nerve, right? And again, the slump test is just a part of a full examination. So even if this test is negative for you, a full physical therapy evaluation would really be able to tell you for sure, is the sciatic nerve involved or if it's not. It's just one piece of the puzzle here, but please feel free to try and let us know how it went. Please leave other questions in the comments as well. And definitely, if this is positive, please visit us on our website and come talk with me through a free discovery session so that we can determine if Natural Fit might be able to help you out with some of your sciatic nerve, back pain, problems that you're experiencing. I hope you guys have a great day. Keep moving, and I'll see you next time. Bye.